It's Kidney Education Month, and for women, there are some common problems that we deal with. One of the main issues, UTIs, urinary tract infections, and there are several ways we can get them. And to talk a little bit more about all of this is Dr. Jerisa Berry, an ER physician and co-owner of Viral Care Medical Center.
Yes.
Thanks for joining us this morning. Nice to have you with us again.
Thank you.
Nice having you on a regular basis to talk about women's medical issues.
Yes.
What are some of the most common types of UTIs, or is there one most common?
There's several types of urinary tract infections, meaning there's different bacteria. And so a lot of times it's important for women to get a culture, especially if you're older or even younger. If you get a urine culture, that lets us know exactly what bacteria is growing, and we can treat appropriately with different bacteria, with different antibiotics.
What triggers some of these UTIs?
In women are 10 times more common than men to get a urinary tract infection. We have shorter urethras than a man. And so because of that, it creates an environment where bacteria loves to grow in that shorter urethra. So we're more common, and it's very important, early symptoms, burning, frequency, any type of discomfort, to seek care immediately before it advances and affects the kidney.
So if you feel like you always need to go pee, I mean, let's just say it.
Yes.
And you have to go all the time and it kind of burns or hurts. Let's get it out there because we want women to know.
Yes.
Then you really need to call your doctor right away. And you're not bothering your doctor when you say, geez, I feel like I'm going to go to the bathroom a lot. That's, you want to see that woman.
Absolutely, absolutely. You want to treat the infection when it's early and not allow it to advance to the kidney, where at that point you need longer antibiotics, you develop fever, back pain, even may need hospitalization if it's affected the kidney.
And I think that's one thing that we as women think about with these things. Oh, it's not that big a deal, but it really can lead to a much more serious issue.
Yes, if it's not treated early, it absolutely can.
Are there over-the-counter treatments that you can get if you think you have the early stages of one before you call your doctor, or quote, we think bother the doctor?
Yeah, even if you start to get early symptoms, the over-the-counter medications, they're good for symptomatic relief, but they're not good to treat the root of the cause, which is the bacteria. They're great for the discomfort and the pain, but you still would want to see the physician to get antibiotic treatment.
So if I have to wait to see you until tomorrow morning first thing, grab an over-the-counter treatment to take till I see you, but don't not go see you.
Please don't. Still come see the doctor.
Are there some invasive ways sometimes that you have to resort to treating these, or are they mostly non-invasive?
Usually it's non-invasive if you catch it early. Now when it gets to the point where it's affecting the kidney, then you would need IV antibiotics versus simple oral antibiotics and hospitalization.
Boy, that's a good reason to see you right away.
Right away.
Any ways we can prevent these from happening, UTIs?
Well, hygiene is important. So definitely, wiping from front to back. Also, urinating often, drinking plenty of fluid to flush out the bacteria is very important as well.
All right, good advice. Thanks for joining us with this info. We appreciate it.
Thank you.
We'll see you in a couple weeks for another topic. If you've got a topic you'd like our doctor to talk about, ladies, please get it to me because you're happy to take it on.
Absolutely, absolutely.
Thanks again.